Hi, I'm Dr. Duke, and this is Run Smart New York, part 5 of a mini-series about trying to create flexibility, pliability, and strength to the hip. Today, it's all about being limber, and we're going to talk about flexibility only. All right, let's get going. The first stretch I want you to work on is a full kinetic change stretch, where notice how Michelle is getting into this posture. Her leg diagonally lays off of an elevation. You could use your bed or a table or a couch. And then as she rotates her chest closer to the table, there gets a nice stretch to the erector spinae group. And if I bring her leg even a little further back, now we're getting into the tensor fascia lata. That's part of that IT band, and we want to keep the TFL nice and loose. Excellent. Come on out of that stretch. Come in front of the table now, and let's do a modified pigeon pose. Put your leg up on the bench. Great. Keep the angle really narrow, like pull it in. Can you see how narrow her knee is? Now I want you to get onto your hands and just lunge into it. Bend this back knee. Nice. And that, you should feel a good stretch on the outer part of that hip. Now come out of that stretch. Come all the way up, and now we're going to make the angle really wide. So we're going to pull it like this. This is going to get a little more to the quad and the IT band. It's going to really hit the back part of that hip. Now get that leg further back, and now dive into it. Bend that back knee a little bit more. There we go. Where are you feeling that, Michelle? Exactly. Excellent. Now let's come out of that stretch. Perfect. Lay on your back. Put your head up over here, legs down that way. All right, the hamstrings. Can't forget about the hamstrings. Get a rope if you don't have one. Go to like a local sailing store if you need to. You don't have to buy anything really fancy. And now, notice how her foot is nice and flexed in this direction. That way we get the kinetic chain all the way down. We're getting to her calves and her hamstrings. So the hamstrings are 3 different muscle groups. First, let's just get the basic one. Pull it all the way up. And anytime you hold a stretch, hold it for like 15 to 30 seconds. You don't need much more than that. Then take it to the side. And now pull it up again towards you. Excellent. Now we're getting the lateral hamstring. That's the one that attaches to the outer part of the shin, the fibula. And it goes all the way up to the ischial tube. And then I'll get out of the way, come all the way out to the side. Pull it up a little more, and now we're getting to the medial hamstring group. Excellent job. Let's put this down. This is turbocharged sports medicine. We can't spend a whole lot of time stretching out. Now scoot over to the edge for me, Michelle. I want you to grab that leg, anchor it up, maybe grab underneath your knee. It holds it a little bit better. Bring your other leg up, grab your ankle, and now drop this down to the ground. Squeeze your glute as you're doing this. This is a really good way to isolate the front of the hip called the rectus femoris and the iliacus. When she squeezes the glutes, it causes a reciprocal inhibition or a relaxation to the opposing muscle group. And then when she brings this leg all the way up, it keeps the pelvis nice and level. It makes it more challenging to do this. All right, come out of this stretch, come off the table. Let's focus still on the hip flexors, but face that direction and get into a nice deep lunge. Great. Make sure that your kneecap is on top of your heel. Get this leg on top of the bench. I like an elevation for all these stretches. Good job. And now try to take your ankle and hold it. Perfect. Squeeze that glute. Come on, tighten it. It's so hard to do because when she does that, it causes a reciprocal inhibition to the opposing hip flexor muscle. All right, put that leg all the way down. Come off of that. Now what I want to do is have you get into a complicated pigeon pose. It's almost like a yoga pose, but we're gonna change it. Get into a lunge on the floor. Notice the deep bend in her knee. If we can make the bend like a little less, that'll be better. Now try to get into that stretch in the front. I think you're gonna need someone to help you with this. I don't think that most people can do this by themselves. So I'm gonna gently bring her leg up just like this. This is a complicated movement, but what a great stretch. Michelle, grab your foot. Just see what you can do. Can you get it? Just hold the laces. Don't, I'm gonna let go. All right, there you are. Breathe into it, and you're gonna feel it like all through the front of the other hip and into the hip flexor area. Now let's drop that down nice and safely. Excellent, come on up out of that stretch. Let's continue. We're gonna get deeper into the psoas. The psoas is a muscle group that attaches to the inner part of the hip, but it runs diagonally all the way up to like the belly button, but deep inside, it attaches to the spine. And when it's short and tight, it exaggerates the arch in your lower back, and it wreaks havoc on the lower back. All right, so let's get into a diagonal so we can get a good look at this. And let's try the Romanian Arch. Get your arms behind you. And now what I'd like you to do is lift your rib cage up. Nice. Maybe tilt to the side. As soon as she starts tilting, now, actually I want you to tilt this direction. There we go. Now we're getting a stretch to that psoas muscle. And now let's rotate a little bit more. I'm Dr. Duke, and this is Run Smart, New York. Join me for the last part of the mini-series of Being Hip when we go over slide and glide using foam rollers and massage balls to release the tissues around the hip.